Scalp micropigmentation regrets. Scalp micropigmentation gone wrong. Bad scalp micropigmentation or hair tattoo. How to fix it now? Scalp micropigmentation or SMP is a cosmetic medical tattooing of scalp to achieve a certain look. This video is made exactly for the reason that you have to achieve clarity of decision before you actually undergo the procedure, so that you know what to expect from the SMP procedure, and thus you are not left to regret afterwards. Also, we would be discussing that if by any chance you get a bad SMP, how you can fix it or get it removed. Towards the conclusion of this talk, I will tell you 3 types of candidates who should not opt for SMP. Here you are also welcome to ask any questions regarding hair treatment or SMP if you are confused or need guidance regarding hair loss management. Hi, I'm Dr. Preeti Saraswat, cosmetologist, micropigmentation expert and diplomate of American Board of Hair Restoration Surgery. Suppose you are a woman and you want SMP for long hair, or a man wanting hair tattoo post hair transplant or for crown. SMP will provide good illusion of dense hair and will reduce visibility of scalp. It would not add volume to your hair. The beauty of SMP lies in the camouflage. That head is full of hair, but the hair tattoo should not stand out. For the same reason, SMP or micropigmentation is not done to create hairline in front of existing hair, because then it would look very odd. Having said this, let us enumerate the regrets you can have post SMP. Regret number 1. SMP dots are visible, extending out of the normal hairlines, thus showing you have something on your scalp which is not hair and should actually be removed. Regret number 2. The team who did SMP for you did not pay attention to the size of hair tattoo and the depth of dots, due to which the final result came out to be botched and unsightly. Regret number 3. The color of pigment used did not match the color of your hair, or it changed to blue or greenish hue later on, which is very common if the ink used is substandard. Regret number 4, which can be very frustrating one, is that you still look bald. If you opted for SMP for densification, but you had really sparse hair to give coverage to the SMP dots, baldness would be revealing. Regret number 5, you want to sport a buzz cut, but you have got unnatural hairline to frame your face and improper pigment dots. The good news is that SMP is done by semi-permanent inks which fade in 3 to 5 years. So good or bad SMP will eventually fade with time. But if you need to remove the SMP, we have 2 methods. One is Q-switch lasers and the other is salt and saline method. Depending upon the type of SMP, your doctor will guide you for the best. Moreover, if the SMP looks abnormal but can be made to look natural by some tweaking of dots and inks, like in this gentleman, sometimes we can fix the weirdness by art. This brings us to the end of the topic, where I had promised to tell you those 3 types of candidates who should not opt for scalp micropigmentation. They are: number 1, males having frontal hair loss who want to get a hairline by SMP and keep the rest of the hair long. If you do this, you would look like this. Number 2, males having bald crown area with absolutely no hair. Number 3, men and women having excessive ongoing hair fall. Hair fall should preferably be stabilized before you undergo SMP procedure, so that the area of concern doesn't keep on increasing by the time. Also, trichoscopy or computerized hair examination should be done beforehand to find out the extent of the hair loss and also diagnose the type of hair loss to help you with the long-term hair loss treatment planning. I've tried to cover as many regret points here as I could think of in this video. But if you need any more help or suggestions regarding your hair loss treatment, you are welcome to ask in the comment section below or email us or connect with us on the phone numbers given below.